New on daybreak, independent pharmacies across Minnesota are in crisis. Some have already closed their doors. One of the issues causing this is one that some of our local lawmakers believe they can fix. I spoke with the author of House File 1752 and area pharmacists who are gravely concerned.
The pharmacies that are still in business and are desperate to stay in business say they need this bill.
Bill author Representative Tina Liebling tells me 1.5 million low-income Minnesotans get their insurance through the Medical Assistance Program. The state runs 15% of the program, and pharmacy benefit managers, or PBMs, run the rest.
Pharmacies who fill these prescriptions are being way underpaid. So in many parts of the state where you have a small pharmacy on the corner and that pharmacist has relationships with the people in the community and the people there count on these pharmacies to get their prescriptions filled and for advice and other support, these pharmacies are being driven out of business.
According to Liebling, the state currently pays pharmacies about $10.17 per prescription, while the PBMs pay as low as 10 cents. House File 1752 would take out the middleman and make the program solely state-run, saving the state money.
This bill is key to us surviving, to be able to fight another day and to continue on.
Deborah Kevney and her husband are second and third generation pharmacists in Winstead. She founded a group of independent pharmacies in Minnesota who help each other and push legislation benefiting their businesses and patients. She calls the reimbursement practices of the PBMs abusive and unsustainable.
Let us compete on our merits. Let us compete on our service. We'll never be able to buy drugs as cheap as the Walmarts, the Walgreens, and things like that. And that's fine. That's the market. That's the way free markets are supposed to work. But on a level playing field, if I get to compete with the big boxes on service and taking care of my patients, I will beat them every day. And that's all we're asking for, is that opportunity.
These dots represent the southeastern Minnesota cities that had a pharmacy in 2006, but don't have one today. One of those dots is Harmony. How did it feel when you had to sell your pharmacy when you didn't necessarily want to at that time?
It was very depressing.
The storefront of Harmony's pharmacy sits closed up and empty. But let's take you back to the early 1980s, when Eric Slindy's family became involved in the pharmacy, eventually becoming full owners. By the 2000s, when the PBMs were created and the reimbursements kept changing, Slindy sold the business 13 years premature of his retirement.
We sold the pharmacy to a small chain when we still had something to sell.
That chain later sold to another chain, then Sterling Pharmacy closed it last year.
When I was still practicing, I had a relationship with one family had 6 generations. 6 generations.
Slindy has hope this bill could turn the tides for independently owned pharmacies and bring a pharmacy back to his small community.
And it won't come back until the reimbursement model gets better so that a newer, younger person can manage to come in and serve Harmony again.
Wednesday, Kemper Drug and Gift in Elk River became the latest Southeast Minnesota pharmacy to close. It announced on Facebook that all prescriptions would be transferred to Walgreens.
That drugstore had been in that town for over 70 years. They ran diabetic clinics for their patients. They knew everybody by name. It's just very, very sad. And when you see a store like that has to close because of economic reasons and what the pharmacy benefit managers are doing, as the middlemen in this whole transaction, it's scary.
As pharmacies find themselves at a tipping point, crunching the numbers, they believe House File 1752 is the best immediate hope to keep your local pharmacy open. But Representative Liebling and pharmacists agree this bill is just one piece of the puzzle.
The drug industry is one of the wealthiest industries in this country. They are making money hand over fist. And a lot of the fix has to come from the federal government because these are national things. But as state legislators, we are working as hard as we can to try to find solutions.
The bill had a hearing in a House committee, and it's expected to have one in the Senate. House File 1752 has bipartisan support, with Representative Greg Davids of Preston among the Republicans who are now co-authors. Representative Liebling tells me the goal is to get the bill into the health care package and the omnibus bill to increase chances of it being signed into law.